Hello and welcome to another episode of Nurse Amy online, Nurse Amy on YouTube, depends on where you're watching or hearing this. I know I've been talking about doing question and answer, and right now I have actually decided to talk about a topic which is from one of my questions um, that I got in my email. So I'm just going to go right into it. And this is, please, Nurse Amy, can you talk about the difference the between school and real life nursing? So this is something I like to give a title or describe as book world and work world. What's the difference? So book world versus work world. If you've been through my class, for those of my students, you would know I talk about book world and work world. There is such a vast difference. It's like night and day, and that is the truth of the matter. It's like night and day. So, what is the difference? In the book world, everything is perfect. Patient is perfect. You only have the one patient anyway. All the staff just, again, is a perfect word. So you just want to assume that everyone is on good terms with you. The doctor is happy with you. He's happy to receive your phone call. He's ready to work with you. I mean, your best pals. The patient, oh my God, the patient is just perfect. The patient is an exemplary patient who doesn't give you trouble. He doesn't talk back. Now, when I say talk back, they're not kids, but there are difficult patients that even if you're giving them instructions or you're teaching them, they just love to aggravate you, one, or maybe they don't know. But anyway, this patient is none of that. This patient is lovely. This patient does whatever you tell them to do. Again, this is the book world. That's the mind you go into the book world. Everything is perfect. Everything is easy. You have all your supplies. You have, you can call pharmacy and they're also helpful. Lab comes only when they're supposed to come and not when you're, overwhelmed or saddled with so much work. So everything is perfect. So book world is perfect world. On the other hand, in the real world, which I call work world, it's totally different. For one thing, you have more than one patient, okay, unless you're doing home health. But even then, with your home health patient, you have to deal with the family if you're doing shifts, okay? There are different types of home health settings or schedule, okay? There are those where you just do drop-in visits. So that means you have more than one patient and you're dealing with more than one family and you're dealing with more than one case scenarios, the driving, the aggravation. One thing I hated about home health was during winter months. Again, you're going to visit people that need you to help them. So their priority is not coming out to clear snow on the driveway. So that was something I was always scared of and about home health. But anyway, we're not talking about home health today. So remind me, I can talk about my experience with that. However, where are we? So again, work world. Work world, if you have just doctor's offices, so there's more than one patient, sometimes there's more than one doctor you have to interface with, and of course you have the ubiquitous pharmacy calls, lab, family. It's, you can't get away from it. So that's one of the differences, okay? The number of patients you have, the workload is different, okay? It is always different. In the book world, you are just, again, just dealing with what you need to deal with for that particular time to pass your test, okay, or to pass your exam or your quizzes. That's all you're dealing with at this time. However, in the work world, while you're not actively trying to pass an exam, sometimes you are on the side, you're in school, okay? For those of you who are CNA students, sometimes after going through CNA, you start your nursing school and then you're working as a CNA. However, you still have all that schoolwork to do as a nursing student, right? I'm sure you can agree with me. So that's one. Okay, do you see how things are getting different? In the work world, there are more things happening. Nothing is actually stable. Nothing is as it is. Things are constantly changing, and you always have to interface with different people. That is the those are differences. Okay, so that's one. We've got the workload down. Okay, so in the book world, the workload is light. It's very light. It's beautiful. It's nice. I mean, you get a chance to practice all the things you've been taught to say, to do, to care. Again, it's a perfect world. You need to understand, for all nursing students out there, whether CNA, whether LPN school, whether RN school, even medical school, any school you're in the healthcare field, and I dare say it probably applies to any kind of schooling scenario. Book world is a perfect world. Your workload is very, very minimal. So that's workload. The second thing is, so let's talk about the patient. Okay, now something I'm also going to start talking about is my experiences as a nurse all these years. I've worked for about 20 years in the nursing healthcare field. And yes, it's a lot. It is a lot. However, I love what I do. I really do. And I have met some of the worst people ever, family, patients, even colleagues. And I've also met the best type of people: family, patient, colleagues. So, again, I always tell people healthcare is like going into nursing and healthcare in general. It's a mission. It's a calling and a mission. You have to know why you're there, because it gets tough. However, it also gets better, because the more you do it, you're being trained and honing your skills, communication skills, how to interface between doctor, patient, family, patient, colleagues. Oh dear, colleagues, management, colleagues. But that is the truth. But it shouldn't deter you. I tell my students that, and even non-students, you cannot let that deter you unless you don't know what you're about. You can't let, just because things are not working the way they ought to, should that discourage you. That's why it's a mission and a calling. Okay, so number two, we're going to talk about the patients. So the patient, well, for most of the time, I teach a CNA. I am a CNA instructor. I also teach some classes for some nursing classes. It's just that they're longer, and I at this time I really cannot commit to that long-term coaching in a school, but I will do it on the side, so I do have people I'm actually coaching and reviewing, their skills and their reading knowledge exams with. Anyway, that's an aside. So we're talking about colleagues. For most of the time in nursing school or in either the nursing school or CNA, which is still part of nursing, the patients don't talk back to you. They're not necessarily aggravating you. There are case scenarios, but then again, it's on paper or in the computer, and you're just trying to, again, you're calling on your nursing intervention on how to deal with situations like that of the real world. And in CNA class or in the lab, you're not, again, dealing with real patients. Now you have an actor who's, again, being told, if you're doing the states test, who's being told how to act, and pretty much they're just acting. They're not really belligerent. They're not aggravating you. They're not trying to jump out the window or pulling out their G2 or spitting at you or hitting you. Now, those things can be implied when you're taking an exam, but it's just the one patient. They're not physically hitting you. So that's the difference. Do you see how that works? So we've talked about the workload. You only have one patient, okay? And if you have more than one, it's you're reading about it and trying to solve problems. So they're not real. So book world, work world. And then we talk about the patients themselves. They're nice, you know. You work with mannequins. Mannequins are not screaming at you, calling you names. Some very choice words sometimes that you either cry, you're angry, but there's nothing you can do but to move on. And sometimes just chuck it off to, oh, it's frustration, oh, it's pain, oh, it's some cognitive decline, oh, it's family making them do whatever, you know, just so you can get through the day and do your work. So patient the book world, patient doesn't talk back. Patient doesn't hit you. Patient is pretty much malleable, pretty much does everything you want it to do. In the work world is different. In the work world, you get called names. In the work world, they will hit you. In the work world, they will lie on you. And this is something I tell my students and even non-students, because right now, since I started doing this, I've actually had a lot of people write to me, and I'm having to do private coaching, which I don't mind. But yeah, you know, people have asked me, how do I cope with all this since I have all this experience? I do, good and bad. For those of you who are new to my channel, something I do suffer from, or I've had to be, I trying to manage, is chronic lower back pain. Sometimes it gets really bad. So if you know anything that works, let me know. Subsequent episodes, I'm probably going to share with you some of the things that seem to be working for me. I just need to be consistent with doing it. Okay, so we're talking about in the real world patients. Patients, we throw books at you. Patients, sometimes we throw their body fluids at you. Again, there was a colleague of mine who actually, it was a belligerent patient who, according to her, she felt the patient was just trying to get back at her because, again, the light, that call light, you know, that the book world tells you everybody answers. Well, it doesn't work like that in the real world, okay? So this patient didn't get the light answered in time, and through her urine at her. Yeah. So she had to get her eyes washed out and all that good stuff, and hoping, keeping fingers crossed that is not infected. These are all the things you go through in the work world, okay? Patient gets angry. Family gets angry. Following so far? So another thing is, in the book world, there's certain times when you're not supposed to use gloves. You really shouldn't. Let me see. What are those times? Well, for one thing, when you're feeding them, you shouldn't have gloves on. No. Unless, of course, your state tells you. Now, this is something you need to understand. When I come in here and I talk about the topics, it's because it's been my experience, and I've worked in like 3 or 4 states. States are not all the same or agree with ways that let me see, skills are done. There are basic techniques, and I do teach that if you look at my videos. They're basic techniques, but I always tell you, especially as a CNA, you need to know what your state requires of you. Okay, you need to know that. So moving along, so we've talked about workload, we've talked about patient. How about talking about doctors? Now, for me, thankfully, knock on wood, people say, knock on wood, knock on computer. Some have actually had a very, very bad experience with their doctors. Okay. I thought I should lift this. It's better this way. If I do that, then that's better. Is this better? Yeah, as opposed to having it like, yeah, this is so much better. Anyway, so something that people have complained about is doctors, mean doctors. I don't know why doctors are mean. The only thing I can surmise is that they have, what should I say? They they are under so much stress, just like everybody else. The nurses, the aides, the pharmacists, the labs, we're all under stress. But I guess some feel entitled to do what they do. So again, I've told you guys that healthcare is a structure based on hierarchy, and at the very top of it is doctors, or you have doctors. Okay, we're not doing grammatical correction right now, but at the top of it are doctors, so not is doctors. Okay. Anyway, so we have that. So in the book world, doctors are nice. The doctors are very nice. They just write the orders and they pick up your phone when you call them. They tell you what to do. They clarify for you the orders and all those things. They even offer to help you change, just like this is what I tell my students. Even nurses help you to change. Yay! Isn't that cool? I mean, it's a perfect world. You need to understand that, okay? So that's the book world. Doctors are all nice. Everybody is nice. Everybody is great. Everybody does all they're supposed to do. Okay, work world? Hello? Are you in a dream? Doctors helping you to change patients? Doctors being nice to you on the phone when you call them, bothering them, telling them about patients they probably do not even remember. Why? Because they have all these patients they have to deal with. I have been lucky because I've not really had any doctors insult me or be mean to me. And thankfully, thank God for that, because it's not something I think I condone. It doesn't matter whether you condone or not. That is just how they are. But I've actually had nice doctors. I've worked with nice or nicer doctors compared to others. But I have heard horror stories, okay? And I think the reason for me is very early on in my nursing career, I had made a conscious effort to actually move away from hospitals. Initially, I had worked in hospitals, but I think it was just it got to be too politicized for me, and all that. It was just so much bullying going on. It was just painful. People were very mean in the hospital. So I think very early on in my career, I kind of moved away from there. Now I will go in, pick some hours, and then move away. So for me, when the doctors talk to me, for those who try to pull rank, I am one person that, and I think when I went into nursing, I was a bit more mature. So it wasn't like I wasn't all what's the word now? Starry-eyed, scared. No, I could give back as much as I got. I mean, I wasn't being rude, but I was being assertive, which is something also I would like to talk about, on how to deal with people that are not necessarily, they have a problem, it's not you. People who want to come off and bully you. You can be assertive without being rude. Again, you know what you're doing. As long as you know what you're doing, you're prepared at your end, they will end up actually dealing with you in a respectful way, because they know if they push too much, you will not take it. Do you see what I'm saying? But anyway, so with doctors, in the work world, no, they're not that nice because they have so much pressure on them. But what they forget is the person they're also talking to has pressure. Okay, so that's the difference between work world and book world. Yes. And then again, I don't know, did I treat the gloves? Okay, so in the work world, no, book world first, there are certain skills where for you to pass your exam and to pass your test, you need to know that you will not be using gloves with certain skills at certain times, because it doesn't require gloves. At this juncture, you need to know about standard precautions and also transmission-based precautions, okay? If you don't, check out my lecture series. I talked about it in one of my videos, okay? So I'll probably put it somewhere up here or down, I don't know, but check it out. So in the work world, We all glove up. Sometimes we double glove, even triple glove. Have I done that before? Yes. Is that the right thing to do? Probably not. The book would tell you no. The only time I tell my students this, and I tell even non-students, the only time work world actually apes or copies book world is when the state is around, when you know you have to go back to doing things the proper way. Now, some people might argue, so just hold your argument right now. Well, it's not argument, it's your comments. And you can say whatever you want, really. But I know what I'm not teaching right now. I am talking real life, okay? I got a letter in my email. I got an email asking me to compare both, and I am comparing both. That's what I'm doing. Okay, it's not about, oh, Nurse Amy's teaching their students to double glove, triple glove, and what have you. You do you. Okay. And let me just go ahead and answer this question. So having said that, you have to protect yourself in the work world. So you do find, as nurses, sometimes we're doing treatment. It's more efficient, just again, to double glove. And sometimes even triple glove, depends on what you're doing. Some people don't do it, some people do it. Have I done it before? Oh, yes, I have. Again, unless you've worked, excuse me, unless you've worked in my shoes, where I've had up to almost 50 patients, excuse me, in a shift. And I had to do treatments and I had to do IVs because someone did not turn up. Okay, so I had to take on, and that's the thing I mentioned just now. I moved away from, it's like a catch 22. So I moved away from working in the hospital, which I did. It was back-breaking job, and because it got to be too much. Okay, now that's not to say people were not doing it. For me, it wasn't more like a career nursing thing for me where I was going to go into management. I really didn't want to. But then again, I went into nursing home, which is a totally different beast. And again, I will be talking about nursing home later on subsequent. And if there are specific things you want to ask me, please go ahead and ask me. So let's see, what else? I'm so excited. I might do this into maybe two parts, because there's just so many differences. Again, book world and work world, two different worlds, night and day. Let's see. So in the book world, call lights. They tell you everybody gets call lights. The nurse, the doctor, the maintenance people, the laundry people, people from dietary. Let's see, even the only people who don't get lights are the visitors, the family, right? Because they're not working in that facility. Huh. I will tell you this though, in the real world, family will get lights. I have seen it happen before. Why is that? Well, because there's not enough staff. And sometimes I've worked in a place where families started to, I'll be in someone's room doing treatment, and a family member will come and say, I'm sorry, I know I'm not supposed to do this, but this lady was almost falling off her bed and I had to go in there. Her light was on. Yes, it happens, people. It's work world. In the work world, everybody tries to help when they can, or they don't even when they can. So call lights. In the book world, it tells you everybody answers it. Well, in the work world, nobody answers it. You get your call light. And even if they get your call light for you, guess what? They just come to tell you, well, so and so need this done. So and so need to be transferred. So and so need to be cleaned up. So and so need the book read. I don't know, whatever. But they will be telling you. They will not be doing your chore or your duties. Now, does that mean they're bad people? Not necessarily, because they also have their hands full. And now some of you might argue, but come on, How long does it take to transfer someone from the bedpan, or transfer someone from the commode or from the bathroom, or have them just change their adult brief? Remember, we don't say diaper, we say adult brief. Or how long does it take just to get the remote? Well, the remote is the easy one. But sometimes you find, again, I'm playing the devil's advocate here. I'm not saying that people who don't help, teamwork works. If you've heard my videos, I talk about teamwork. Some people don't believe in it. Well, then you're the foolish ones, because teamwork actually cuts the work in half. But there's no teamwork in the work world. However, in the book world, there is teamwork. Everybody gets the light. Everybody helps you transfer, even when you're not there. Even if you have that one patient, everybody comes and they help you, and everybody's happy. I know this is silly, but it is so true. The book world is just perfect. If we all could practice in the book world, believe me, no one will work in the work world. But it doesn't happen that way. So, teamwork. I started talking about it when I was talking about lights. There is no teamwork in the work world. I have had the opportunity to work in with teamwork and also no teamwork. I would pick teamwork any day, every day, all the time, all day. But that's not how it works. There are people who think that they can work all by themselves. They're Wonder Woman, they're Captain America, and they're the Hulk or the Thing. They do not want to do teamwork. Give them the assignments. They want to do their assignments. They want to answer their call lights, and that's all they want to do. They don't want to interface with anyone but themselves and their patients and all they're supposed to do, and they're ready to go home. How can you change those people? Please, I would like to know. Because I have seen them with full-time staff, I've seen them with agency staff, I've seen them with PRN staff. It doesn't matter. You would find evil people in healthcare and you will find good people in healthcare. You have to pick your battles. You can't go into healthcare every day fighting people. Is not worth it. Nobody has time for that. I'm moving my computer around too much. Sorry about that. So what else? Let's see. Oh, yes. Oh, in the book world, the nurses are very nice to you. Your colleagues are the best. Oh my goodness, they pick up the phone. They not only relay the messages, but they even help you do whatever the person on the other line wanted. Maybe they wanted to talk to some family member in their rooms, or maybe some doctor was calling to give an order, and this nurse actually takes it and transcribes it and calls pharmacy and lab and just does your work for you. Okay, that's book world. Book with everybody's fine. The nurses are great with the aides are great with the nurses. Everybody's all kumbaya and happy and holding hands and singing praises. Okay, so let's do work world. Well, that doesn't happen, sweetie. You need to understand that. Now, some of you might say, oh, well, yeah, no, that's not true. I've worked somewhere where we're all friends, we all look forward to getting to work. Okay, that's fine. That's the exception. And I'm happy for you that's happening to you, but that is not reality. Talk to a nurse who's been doing this as long as I have, not just in one place now. I don't want nurses or aides coming to me, oh, I've worked in this regional hospital for 24 years and we're all great. 24 years is enough time for you to be great and love each other and marry each other and have babies together. That's not what I'm talking about. I'm talking about a nurse who has worked in more than one care setting, has worked with different kinds of people, not the people you entered with nursing with in 1950. That's not what I'm saying. Okay, I'm trying to be funny here, but maybe it's not so funny. That's okay. This is just me trying to differentiate as much as possible the difference between work world and work world and book world. Okay. Yes, teamwork really doesn't exist in the work world. I wish it did. And I wish after, I'm going to talk, there's so many things I really want to talk about. Now that I'm talking about it, I wonder why I haven't done this before now, because I'm really getting fired up. You know, because when I think about it, there's a lot that goes on our work. I think one of the reasons why I haven't wanted to talk about it, I just want to concentrate on coaching my students and just making them the best nurses and the best aides they can be. But they also want to know my experiences, and I don't want them to be blindsided. If you check out some of my videos, I talked about stop bullying CNAs. CNAs are dear to me. Why? Because I believe that I find that I need to constantly push them to appreciate who they are, and what they bring to the table. And now that I coach them, I'm kind of, it's important to me that they're not hurt. It's important to me that they are also proud of what they do. You know, I think I did a video where I said CNAs are the bane or the bedrock of healthcare. I'll put that somewhere too so you can see. But please check out my videos. Again, I don't know if I've done this. My name is Amy, for those of you who don't know. And I have a YouTube channel, Nurse Amy. Welcome. And I also have a podcast called Nurse Amy Online. Remember to follow me on Twitter and Instagram at Nurse Amy Academy. And then you can write to me, as one of you has, and ask me this question at nurseamyacademy@gmail.com. Please remember to subscribe to my YouTube channel. Hit the bell so that every time I upload a video, you can always be the first to know. I do coaching. I've been doing private coaching. I do inspirational and motivational cookie points. If you know me, you know about my cookie points. I have a Facebook page. It's Nurse Amy Academy. Please go ahead and like it and watch my videos and listen to my podcast. Okay. So moving right along, here we're talking about book world and work world. So what else is there? Let's see. In the book world, there's certain things you have to do to pass. There's certain ways you have to answer questions. There's certain ways things are in order. Okay, say for instance, say there's someone on the floor, okay, there's something, one of the skills that in the state where I teach, the students have to, they're tested on it if it happens to be one of the randomly selected skills that you have to do. It's called abdominal thrust. And one of the steps is you have to you have to ask the person if they're choking, and you have to get permission from them. Now, there's a universal sign for choking where the person is holding onto their throat, they're trying to cough, their eyes are bulging, face is changing color. Clearly, you know this person is choking. However, in the book world, there's certain things you have to do before you put your hand on that person. You have to get permission. However, in the work world, it's not necessarily like that, because again, you just go into gear. You are already trying to help that person purge whatever it's blocking their airway. So those are some of the little things, you know. Again, you doing that doesn't mean that you're a bad person. No, it just means you're human. Okay, in the work world, you're not asking, are you choking? Okay, my name is Nurse Amy. I have been trained to give you abdominal thrust. Is it okay for me to? You don't have time to do all that soundtrack. Okay, you're going into gear. However, in the book world, again, remember, everything is perfect. So the person choking is also going to wait for you to get to read to, what's the word now? Is it Mirandalize them? You know, your mini Miranda. You have to give your title, give your name, tell them what's, you know, qualifications you have, and then ask them if they can touch, you can touch them, get their permission before you move on. That is the book world. That's how it goes. Okay. Something I've also talked about in classroom is sometimes you find someone actually asked me this, and she's like, oh, I can't. Um, hmm. This just takes me back because I remember the first time as a nursing student that I had to go do the first treatment I had to do. It was a wound we had to pack. It was so. It was the atmosphere. It assaulted our nostrils, assaulted our sense of smell. It was so bad. We're choking because I'd never seen anything like it before. We have never. And my nursing instructor then, I don't know, I think she's probably passed on. Anyway, because she was an older lady, old school. We couldn't wear masks. Now I'm hearing that in some nursing schools, for some clinicals, you're allowed to wear masks when doing you're doing dressing. That wasn't something that I was given. We didn't have that luxury. But anyway, and then one of the students had asked me, "What if you go and someone had a bowel movement?" Oh my God, I'm gonna have to wear a mask, and they're allowed to wear a mask now. Okay, that's new to me. Again, if in the book world, that's not something you're going to be doing. For one thing, their bowel movement doesn't smell in the book world. But if you have to do that in the work world, you have to have, because sometimes these patients, they know, okay? And if they ask you when you're not supposed to be wearing gloves and you're wearing it, or you're not supposed to be wearing masks, well, everyone wears masks now. This is COVID-19 coronavirus era that I'm doing this video. Lord God save us all. Everybody's wearing masks now, so you don't need a reason to explain to them. But I will tell you this: um, in the work world, people feed people with gloves. In the book world, please do not do that unless your state asks you to do that as part of your skills. But if you're wearing gloves, you're not supposed to, and they ask you, you better have the reason. You better know why you're wearing it. And something I had shared with them is, again, it's like you have a cut on your finger. Make it about protecting them. That's why you're having those things on. Or you've got a cold, that's why you have a mask on. But anyway, thank you for tuning in. It's been lovely. Um, if there's certain things I didn't touch on, you want me to touch on, let me do so. I actually had a new student of mine who wrote this to me, and I'm going to see if I can bring her on, okay, to talk about her experiences. But then there's more than one of them, and just see if we can just all talk about the difference between work world and book world. Believe me, it's night and day. Is night and day. You in the book world, everything is great. Are you kidding? You can actually get to communicate with your patient and be nice and massage their shoulders and brush their hair and listen to them, to their sub stories, because they need to talk. In the work world, you're like the Energizer Bunny. You can barely have time to eat, drink, or even use the bathroom. Many are nurses, including me, working on the floor. We don't have time to pee. It's always a pleasure speaking to you guys. It's always a pleasure just talking. I'm so fired up right now. I'm probably going to do more of this, my experience in the nursing world. Okay, it's like therapy for me. Anyway, you are the only one who can limit yourself. Why do so, darling? Please do not limit yourself. Keep going, keep forging ahead. And remember, always remember, Nurse Amy is your biggest cheerleader. You can do it. You're stronger than you know. Until I come your way again, be safe, be kind, and be blessed. Take care. Oh my God. It's interesting.